So Cimicifuga, that's a common name. This is how it looks like botanically. It belongs to the Ranunculaceae family, that is a Pulsatilla staphysagra family. The first prove, the first prover who worked on this idea of Cimicifuga was Hempel in 1856. Pierce, Plain Talks on Materia Medica, a very interesting Materia Medica book I want to introduce you to, always gives the name and the meaning of the uh, remedy. So Cimicifuga comes from the word cimex, which means to drive away, and resomosa like grape. So you can see they are grape-like. That's why you can see Resimosa, Cimicifuga resifosa. So Boger writes that the main genius of this remedy is a lot of oversensitiveness, a lot of irregular alternating symptoms, and a lot of aching and violent pain. An interesting line written here is here and there. Interesting, which I will tell you about. But what interests me is what Dr. Shankaran's father, Dr. P. Sankaran, has written, which I believe is the main idea of Cimicifuga. He says, when you think about Ignatia, you should think about Cimicifuga. Boger calls it hystero, that is emotional, utero, that is the uterus, fibroids, and dysmenorrhea, and rheumatic remedy. And considering its wide affection on hysteria, rheumatism, and pelvic disorder, Cimicifuga we are not using as much. It is more indicated than ignatia. It has many pains like McFoss, aching, shooting, soreness, shocking. So we will discuss about it a little bit more in detail. The main thing in which I have used it is in cases of cervical spondylosis. Cervical spondylosis, neck pain, where patient cannot move the neck at all. The first remedy I think about is Cimicifuga. You can see this in Lippy's Redline Keynotes. The other interesting rubrics which I see for Cimicifuga is retracted neck, rheumatism neck, pain neck shooting occiput, and slightest draft of cold air affects the neck, and then it becomes stiff. Very often you are giving Rustox in cervical spondylosis. After Rustox, think of the remedy Cimicifuga only when indicated. The other very important symptom which I often seen along with it is they will often say there is a pain in the eyeball or in the temple extending to the eyes, and radiating pain into the eyes. So a lot of migraine symptoms. A very important area is the nape of neck. I remember first time I went to Kolkata, and I remember one case, Bengali case, and patient was speaking in Bengali and he just pointed towards his neck. So I was not understanding Bengali at that point. Dr. Sarkar told me, remember, if you don't understand Bengali and patient points toward the neck, first remedy you give Cimicifuga. Although it was a joke, but that kept in my mind. Remember, that is a very important sphere of action. It is a top remedy for us in arthritis deformans, in many cases of rheumatoid arthritis, especially with night aggravation, with motion aggravation, damp weather, and when there is a miasm behind, especially the psychotic miasm. Some modalities are important. There is a strong aggravation around menstrual period, climacteric. There is a very famous keynote: more the menses, more profuse, more the suffering. So that's more related to the dysmenorrhea. Also damp, cold, it's so very chilly. And just like Rustox, better by open air, pressure, and warm covering. Also better by open air gives it a little bit like pulsatilla, which is a sister of Cimicifuga. Very often, history of disappointed love, history of business failure, history of lot of insult is a very important theme of Cimicifuga. Childbearing, that's also another important. Very often I have asked patients, how do you sleep? And they will say arms over the head. That is also important symptom for Cimicifuga. So now let us talk about some important areas of Cimicifuga. We'll start with the female genitals. It has a specific action on the hormones. That is why, along with menses which are dark and coagulated, which is like medorinum, there is a backache. And very famous symptom, from ovary to ovary there is pain. But what I've seen very often, patients often tell me pain goes to the thighs with the dysmenorrhea. I have often given Cimicifuga for that. And often there is PCOD whenever you get the dysmenorrhea. So remember Cimicifuga for PCOD. But main thing I want to tell you, there is a lot of background of hysteria. So they will get a lot of group of symptoms: eructation, nausea, vomiting. and a lot of sinking feeling in the epigastrium. Also very important remedy for colic, especially better by bending double after stools. I've used Cimicifuga very importantly in ischemic heart disease, where there would be acute anginas. In old people, patient would often tell pain radiates from all over the chest, and as if there's a tightness. With the history of lot of slightest insult, with needle-like pain in the heart, often I've used Cimicifuga. One thing in which we don't know it much about is the cough, and there is a cough especially dry at night, aggravated by talking. With a little bit of past history of tuberculosis, remember Cimicifuga. I also spoke to you about migraine, lot of pain in the eye, better by pressure. This is where it comes close to the remedy spigelia as well. Throbbing pain, and there is a very famous open and shut sensation, but I have not seen it so often. Neuralgia, very important. Often neuralgia is better at night and more in the day. I remember a very interesting case of my colleague, and you can say who's like a father-like figure like me, is Dr. Samir Upadhyay from Surat. He described me a very interesting case of thyroid, on which I have written a book, and I have done a lot of research on thyroid, and you can watch my YouTube videos for it. In my book, I've also written about his case, where the patient would describe there would be thyroid pain before menses, and he has given Cimicifuga, and the patient got much better. Very, very interesting symptom for him. What else? So some keynotes we can find: chilliness, numbness, radiating pain, especially aggravated motion, neck and back. So rheumatic affection, you should think about it. But what I want to tell you is about the state of mind. This is something that not many people speak about, and this is where I have kind of worked on at a deeper level. What I found it is that it has a state of mind very similar to HYOS and LACH, which means they'll be very, very talkative. They will talk from one topic to another, one topic from another. However, they will also have a lot of suspiciousness about people around. There's a lot of mistrust, and there's a lot of feeling as if someone is doing something wrong against me. But there is a lot of sensitivity, and there is not revenge like thoughts of Lachesis, but sensitivity, where someone has dominated them a lot, and that is where they feel suspiciousness about the entire thing, and their coping mechanism is to talk a lot. They feel internally very restricted. There is an interesting rubric, delusion wires is caught in. In Kent, it has majorly Cimicifuga. The other interesting thing that you will observe in Cimicifuga patient, they will talk very fast, but they will not have the shatir dimag, the kind of sly of lactases. Very interesting thing. They have a lot of tubercular miasm, travel desire, wander desire. So there is a lot of history of TB. Remember, one thing I have seen with Cimicifuga is there is a lot of sighing. This is where it comes close to ignatia. Lot of sighing and dysmenorrhea. Changeability is another thing that I want to. So the pains are changeable. Even the rheumatism stops and mental symptom starts. So there is a lot of mental and physical alternation. Remember, there is also a lot of importance of feeling as if they will go mad, because they start getting strange sensations, and always they are related to hormones, related to menses, menopause, or they can be related to labor. So this is whenever anything starts from menses, menopause, puberty, or during pregnancy, I think about Cimicifuga. One first thing that I always remember Cimicifuga is talkative. They will talk, talk, talk. So I found a kind of a genius of this remedy. The main genius of this remedy is lot of sensitivity, lot of hysteria, lot of changeability, and it is connected to the relation to the menses, menopause, and pregnancy. Also, they will you will see lot of changeability and talkativeness, but the main feeling could always be feeling of hurt, insulted, dominated, restricted, suffocated. So this is a very, very interesting combination of patterns that I have seen. So I want you to use this remedy more often in your practice. Write to me with my email ID, and please subscribe to my channel. Thank you.